Right now, Black women and Indigenous women have the highest rates of new infections. Communities that have the highest rates of any kind of illness need the most resources dedicated to them to address the issue fully. I work from the African tradition of Ubuntu, and Ubuntu simply means I am because we are. I exist because we exist. And the humanity in me can see the humanity in you. So it's very important that we work collectively to address any community that is disproportionately represented in the HIV epidemic. Hi, I'm Notisha Massaquoi. I'm an assistant professor with the Department of Health and Society at the University of Toronto, Scarborough, and a CAMFAR board member. My specific areas of research look at the social determinants of health, and I look at how they impact the Black communities. We have one women's HIV clinic in the country. Ontario does not have any specialty clinic specifically for women living with HIV, and we don't have specific funded HIV services for women. So I created the Black Health Equity Lab. I'm the founder and director of the lab. It's a research lab that partners with Black communities to help develop the tools, resources, programs, solutions to address some of the health disparities that we're experiencing. We specifically look at HIV as our main chronic illness that we focus on, and we are developing racially and culturally appropriate HIV services for the Black community in Canada. If a community doesn't feel that you have their best interest at heart, they're not going to participate in proper HIV care, and that's what we're finding. We need gender-specific services. We need services that actually are engaged in specializing in the health needs of HIV-positive women who are coming from ACB communities, who are coming from Indigenous communities. The AYA Circle of Care, which is the new HIV program that I've created with Taibu Community Health Center, is the first specific HIV program that is looking at primary health care as an option for ACB communities and looking at providing those services in a racially and culturally appropriate way. And it looks at a holistic model, intensive case management, partnerships with organizations, partnerships with the community so that we reduce stigma. And we think that we've created one of the best models that it will be and should be rolled out across the country for ACB communities. I think the thing I wish Canadians knew and understood about HIV is that it is simply a virus. It is not something that requires the level of stigma and stigmatization that we have given it and the way that we have treated people living with HIV. The only way we're going to reach our end goal is if we work collectively together to eradicate HIV globally. This World AIDS Day, let communities lead. It ends with us.